Now we'll quickly look at the technical factors in radiography. So technical factors is more of like, I'm trying to look at the things that could actually affect operation. You understand? So technical factors in radiography is as follows. That's all the things that you should always keep in mind before going. So they are basically controllable parameters, and they could be controlled, but funny enough, they determine how clear your image will be like. Do you understand? And they also determine how much of the X-rays actually gets into the patient. Not only X-rays, okay, radiation energy in general. So things that you should consider include things like all those kilovolt peak, controls the energy quality of the X-ray beam. So the higher kilovolt peak, you have a greater penetration. The lower kilovolt peak, have higher contrast and all of that. So that's what we got. We have the milliamperage and the exposure time. So milliamperage is trying to control the number of electrons that are produced. Exposure time, we are just trying to look at how long this patient is actually exposed to the radiation energy. So if you look at them, the two of them together, you now be able to now know, how the image will be produced. So also we have the source to image distance. We are trying to look at how far the radiation source is from the image receptor. So greater source to image distance, there's less magnification, there's sharper details, but requires higher exposure. And the shorter one should actually be the opposite. So secondary technical factors include the focal spot. So we're trying to look at the part on the body that you need to image. We have the object to image distance, that's the distance between the patient anatomy and the image receptor. So filtrations, we are trying to remove the low energy photons that increase the patient dose but don't contribute to good image. Do you understand? They are useless. So you can use a glass window, you can use oil, you can use a tube housing. So I think that's what we got. You can also use grids, okay, to absorb X-rays that are scattered and channel them to one place. Do you understand? So it will increase the patient dose, but you actually get an imaging that is very clear, rather than not having a clear image and having factors like you want to still do another imaging. Then we have the beam restriction, which is collimation. This one will help to channel the beams just to the part where you need it. Instead of leaving them scattered, it will actually channel them to the place where you actually needed the imaging to be very clear.